Hi, everyone. Thanks for joining me. If you're new, please subscribe and share this video. I want to give my opinion on why I believe Dr. Curry's assessment of Amber Heard. And so this is going to be a pretty thorough analysis. I'm going to show you clips from Dr. Curry as well as Dr. Hughes, and we'll go from there. So first, let's listen to what Dr. Curry has said in her testimony.
How does Ms. Heard's code type fit in with your overall opinion as to personality disorders?
Well, this might be an appropriate time to describe a little bit about these personality disorders, because I think what you'll hear is that there's a lot of consistency there. So borderline personality disorder is a disorder of stability. It's instability, and it's instability in personal relationships. It's instability in their emotions. It's instability in their behavior, and it's instability in their sense of self and their identity. And that instability is really driven by this underlying terror of abandonment. So one of the key features also of this disorder, and all of it is like pistons of an engine kind of firing off and igniting one another. But when somebody is afraid of being abandoned by their partner or by anybody else in their environment, and they have this disorder, they'll make desperate attempts to prevent that from happening. And those desperate attempts could be physical aggression, it could be threatening, it could be harming themselves. But these are behaviors that are usually very extreme and very concerning to the people around them. The anger is typically what, sadly, it's counteractive, right? So the thing these people fear most is being abandoned, but over time, the anger, the explosive anger that they show when somebody is needing space, or when somebody's really not doing anything wrong, because a lot of times they read into things that they perceive as being a slight to them or being somebody intending to harm them that actually isn't happening. They'll exaggerate it, and they'll explode. They'll react in this heightened manner that is just exhausting for their partners. Oftentimes, their partners will try to make them happy at first and really allow themselves to be a punching bag, thinking that they can somehow solve this problem, that somehow they can make this better. And eventually, it just overwhelms them. Histrionic personality disorder is very
Before
similar.
we move on to that,
Okay.
Are you familiar with the term emotional reactivity?
I am.
What is that?
So emotional reactivity is very common in the diagnosis. So essentially, like I said, there's instability in emotions. People with borderline personality disorder are often misdiagnosed as having bipolar disorder because they can be up and down. They can look very depressed, and they can look very elated, but these changes are happening within a matter of hours. Somebody with bipolar disorder, this is a clinical depression lasting days, weeks, a clinical mania where sometimes they even need to be hospitalized because they're so grandiose. They clear out their bank account and go to Vegas and spend it all. They're acting in some very bizarre ways. With borderline personality disorder, you're having these fluctuating moods constantly. And again, this hypersensitivity to being slighted or feeling offended, really driven by the fear that if you're offended or slighted, if the therapist comes in 2 minutes late, or if somebody shows up to dinner 2 minutes late, that they might be abandoning you. And it's not as if the borderline is considering themselves abandoned in that moment, but they just know that they have this overwhelming emotion, and there are no attempts to control that emotion. There are no attempts to regulate it. So if they're in the middle of the restaurant and they feel offended, they're going to start the fight. People are going to see it, or they might just start crying or break down, but they'll make a lot of accusations. And that reactivity is when you're going to see a lot of this escalation in the bizarre behavior. They can react violently. They can react aggressively. They will often physically prevent their partner from trying to leave if their partner wants to get space from all of this intense emotion. And oftentimes they will be abusive to their partners in these situations. Sometimes they'll physically restrain them from leaving and become injured that way. But also, people with borderline personality disorder, it seems to be a predictive factor for women who implement violence against their partner. And one of the most common tactics that they'll use is actually physically assaulting and then getting harmed themselves. But mostly, we call this administrative violence. So essentially, this is saying that they'll make threats using the legal system. So they might say that they are going to file a restraining order or claim abuse, or they might do these things to essentially try to keep their partner from leaving. In the moment, again, they're not consciously thinking, I'm going to keep my partner from leaving right now. They're just thinking, I can't stand this. I hate my partner. They went from idealizing to suddenly devaluing because of the hurt, and they'll do anything to express that big emotion of anger.
Your Honor, may we approach?
Just what Dr. Curry is saying, it speaks to what we've heard on the audio tapes if you've been following the trial, and from the marriage counselor where she testified that Amber Heard did instigate a lot of the fights. And so already it kind of feels like this testimony is supported by the audio that we've all been hearing.
Okay. You indicated you were talking about emotional reactivity. What, if any, emotional reactivity did you observe in your review? Let's do this one at a time.
Okay. So there were a couple indications to me. First, I can sort of think about it with the treatment records. So particularly Dr. Cohen-Connell's, am I getting the name right? I feel like for some reason in my mind, I might have just reversed it. But Dr. Cohen's records, I did reverse it. He actually refers to this reactivity quite a bit and to Ms. Heard's temper. And that temper, it's often branded, or being hot-headed, is really characteristic of borderline personality disorder, as is their very charming, personable nature. This is a disorder of contradictions. In Nurse Filati's notes, I thought there was something interesting. She references a night when they're out to dinner, I believe in London, and she provided positive reinforcement to Ms. Heard because Ms. Heard had been disappointed by a mistake made by the server, and it sort of references how previously she might have criticized the server or become upset by that, and that she didn't this time, and so that had been some sort of a step forward. And there was also an indication actually in Dr. Hughes's, Dr. Hughes is a forensic psychologist who had been appointed by Ms. Heard to conduct as an evaluation as well. In Ms. Hughes's interview of Ms. Heard disclosed that she had cut her arm in the past, which is a typical reactive type thing somebody with this diagnosis can do. It's one of the symptoms. And that's sort of all I can think of top of my mind from the treatment records. Moving into some of the declarations or deposition testimony, what struck me was Ms. Raquel Pennington's testimony. She's a former friend of Ms. Heard's, and she told a story about, I suppose they were shopping for Thanksgiving accoutrements, something to prepare for Thanksgiving, and Ms. Heard struck her in the face, sort of out of the blue, which is I thought was interesting because that is one of those signs of borderline personality disorder where if a friend or a loved one isn't meeting your needs in that moment, borderline personality.
Seems to be an issue with the stream. Let's see.
Person to dumpster. They are totally devalued. They are the worst friend. They don't care anything about me. I have better people around. And then there will be a repair because the person with this disorder does feel remorseful after they have these reactions, angry, tell their friend off. But over time, it wears away at these relationships. And so what you'll usually see is many transitions in their friendships over the years, people who have sort of fallen by the wayside, who were really very close knit at one time, and then, but there's not a lot of consistency in the long term. You'll also see that with their intimate relationships, many relationships, but none that are particularly long term.
Okay, so I'm going to stop right there for Dr. Curry. I thought she did a fantastic job of providing behavioral examples, because as therapists, as clinicians, we have to have a clinical basis. We have to be able to support, our diagnosis. So I felt like she did a good job with that. So now we're going to look at Dr. Hughes' testimony, and how she came to her conclusions. She came to the conclusion that Amber Heard was suffering from post-traumatic stress disorder. So we'll take a look at that. If you give me a second. All right. So we'll hear her testimony and then come back and I'll give you my opinion.
To determine a particular legal question. Forensic evaluation follows a methodology that what we say it's a multi-method, multi-hypothesis driven methodology, which means I look at a variety of different documents and data using multiple hypotheses. It's not just one hypothesis, one theory of the case. You're going in looking to see, what possibly could be going on here. And then you use the data to arrive at that opinion. You look for consistency across the data to arrive at that opinion. And the forensic psychological evaluation has many parts. It has the clinical interview part, a structured or semi-structured clinical interview where I'm asking Ms. Heard lots of things about her life, both before Mr. Depp and after. It involves a psychological testing component of the evaluation, which allows me to do a good broad scan of different symptomatologies that people might have in their lives, as well as to have indicators of how she approached the test. Is she defensive? Is she malingering? Is she feigning? Is she exaggerating? It gives me indications about how she approached the evaluation. I review a number of documents, medical records, psychological records, the text, the audio, all the different things that we've had in this case, and then I conduct collateral interviews.
So, Dr. Hughes, just to be clear, do you assume everything the victim reports is true when you conduct these examinations?
No, of course not. I always approach a forensic evaluation with a healthy dose of skepticism. With any forensic evaluation, there exists a motivation that the individual may be telling you something that is not accurate. It doesn't mean that that's there, but you have to control for that and know that you're looking for, again, what does the data tell you, the external data, about what the person is also telling you.
Did the forensic evaluation follow a standard methodology, or was it specific to Ms. Heard?
No, this is my standard methodology that I would use with any individual who's in a forensic matter, and I would just call to evaluate them.
When did you meet with Amber?
So at this point, I'm just going to go ahead and fast forward the testimony.
For a total of about 29 within them, but the main opinion is that Ms. Heard's report of intimate partner violence and the records that I reviewed is consistent with what we know in the field about intimate partner violence, characterized by physical violence, psychological aggression, sexual violence, coercive control, and surveillance behaviors.
And what was the other main opinion that you had?
The second main opinion was that that Ms. Heard demonstrated very clear psychological and traumatic effects, or the exacerbation of trauma, from those statements that Mr. Depp made through his attorney. There were 3 statements that we evaluated to see how they affected her emotionally and psychologically, and it was my determination that they did.
And did you arrive at any diagnostic conclusions?
Yes, I did.
And what were those?
I diagnosed Ms. Heard with post-traumatic stress disorder.
And what, if any, etiology was associated with the post-traumatic stress disorder?
So the etiology is the cause. In order to meet criteria for post-traumatic stress disorder, you have to have an actual cause. It's one of the few diagnostic entities that we have to have a cause for. And the cause was the intimate partner violence by Mr. Depp. That was what was pushing the symptoms. That was what's related to the intrusive phenomena. That was related to her avoidance. That was related to her differences in her mood. That was related to her avoidance efforts. So it was the cause was the intimate partner violence by Mr. Depp.
All right, so we have there pretty much snippets of both testimonies. I'm sure that if you're watching this video, you've already seen the entire testimony or you follow the trial and kind of know what's going on. So it looks like to me, I want to say I agree with Dr. Curry's assessment of Amber Heard having a personality disorder. So I want to show you the criteria briefly for borderline and histrionic, and then the criteria for post-traumatic. And you as the viewer, you've gotten to see Amber Heard through the eyes of her friends during their depositions. You've got to see or hear with your own ears the audio between her and Johnny Depp. And so I feel like we can take a look at some of these things and kind of come to a conclusion. So first, now this is an oversimplification of these diagnoses, but borderline personality disorder. So like Dr. Curry said, it's a disorder of instability. It impacts the way you think and feel about yourself and others, causes problems in functioning everyday life, includes self-image issues, difficulty managing emotions, and this is from the Mayo Clinic. So these are the main symptoms. Again, there's 9 criteria, but you only need to meet 5 of that. So an intense fear of abandonment, going to extreme measures to avoid real or imagined separation. So the avoidance is about avoiding abandonment. Okay, it's an intense fear. I don't want to rehash what Dr. Curry said, but things as small as coming late for a birthday party, like it was testified in this case, or missing a phone call, to actually leaving or threatening to break up or to leave. Those can elicit very, very strong reactions that are exceedingly intense or disproportionate to like what actually was the perceived abandonment or slight. So unstable relationships throughout the years, changes in self identity, periods of stress related paranoia, maybe like some dissociative behaviors there, impulsivity, risky behavior, suicidal threats or an injury, mood swings, feelings of emptiness, inappropriate, intense anger. So losing your temper, being sarcastic or bitter, and having physical fights. That is all included in that disorder. And then if we look at histrionic personality disorder, okay, so this is from Cleveland Clinic. And then again, it's going to give you a brief overview. It's a personality or a mental health condition marked by unstable emotions, distorted self-image, and overwhelming desire to be noticed. The key with histrionic is that attention seeking, needing to be the center of attention. And so borderline, histrionic, and narcissistic, a lot of people get these confused. And then sometimes they are comorbid, meaning that someone can have both or all three. There could be some mixed personality disorder, but they're all in the same class of disorders. They're in cluster B. And how we were taught to remember cluster B personality was this class was dramatic and erratic. So those were the main features across all 3 of narcissistic, histrionic, and borderline. And so I like this little graphic here, but needing to be the center of attention, seductive or provocative behavior, uses appearance to draw attention, shifting and shallow emotions. Dr. Curry mentioned this about the flower. So impressionistic and vague language, dramatic, exaggerated emotions, thinking relationships are closer than they are. So a little bit like shallowness, needing to be the center of attention. That's more And this is in a way where it's dysfunctional for that person's life. I'm sure we all know someone, they want to be the center of attention all the time, or, oh, this person, is so, self-absorbed, but that doesn't make it a pathology. There has to be dysfunction across different areas in that person's life. So at work, it has to cause dysfunction at work. They can't keep a job. There fights with coworkers, fights with their friends, fights with family. It has to, go across the spectrum there. Okay, and so now we're going to take a look at PTSD symptoms, because Dr. Hughes did mention that she felt like Amber Heard had post-traumatic symptoms. So with that, this is from Mayo Clinic as well. Post-traumatic stress disorder is a mental health condition triggered by a terrifying event. You either experience it or witness it. And so let's look at some of the symptoms. So intrusive memories and thoughts, like flashbacks. So recurrent, unwanted, distressing memories of the event, reliving the event as if it were happening again. That's the keyword with flashbacks. A lot of times you will interview a client and, maybe they had something bad happen to them or something traumatic. And you ask them, oh, are you having flashbacks? Because you're trying to, rule out or rule in, PTSD. And I say, oh yeah, I have flashbacks. But if you press them on, what is that? What does a flashback feel like? What is that for you? What does that mean? And you have to press for specifics. They might just say, oh, I just think about it, from time to time, or, I'm ruminating a little bit. But this is more, flashbacks are the memory hits you and it's like you're back there. You have the same emotions, you have the same response, and it could be noticeable to other people. They're like, what's happening here? So for example, with a veteran and, hearing fireworks, and then they react like it's gunfire, and they react with their body. You can see like they're visibly disturbed. Avoidance is the big key too for post-traumatic stress disorder. So avoiding talking, or trying to avoid talking or thinking about it whenever you can, avoiding especially like places, people, or activities that would remind you of that event. So the avoidance was mentioned in BPD. And remember, that was the trying to avoid abandonment, frantic efforts to stop that from happening, versus PTSD avoidance is, I don't want to be around that person, place, or thing that even reminds me of the trauma. Okay. So the thing that really sealed the deal for me, as far as siding with Dr. Curry's assessment for Amber Heard, was this audio that was played in court. I believe it was played yesterday. Listen to this here.
This is not, bro. This is not happiness. This is not.
Please stop doing this. Please, you're causing so much fucking stress. I'm gonna die at this age. I'm gonna fucking die. You're causing me so much stress. Please stop. Please, I feel like I have a heart attack almost every day. Please stop. Please stop doing it. Please stop. He's so fucking mean.
Why
You're
are
a
you
fucking
with me?
bully. Stop. Please stop. I've been begging you not to fight. I just said, can we please have a normal argument? Just even a normal conversation, fucking normal argument. And for the last hour, I've been begging you to please just leave it at that. Let's just go on with our night. I would have been able to come in with you. We would have been able to let it go in a few minutes. It would have been fine. It would just, if we allowed ourselves to have fucking normal arguments. Please, you're killing me with this. You're killing me. You're fucking killing me. Fuck.
Sean, could you, please, I want you to just go. I want you to take your medicine or whatever. I'm sorry that I've upset you.
Yeah, I think. Thank you, Sean. I'm ready to go. Thank you so much.
I'm really.
Hearing that, her language, I'm going to fucking die, you cause me so much stress, you always do this. She is talking about when Johnny Depp does not engage in an argument. And he, as we've seen throughout this trial, he's the one that tries to run away or get space, or she accuses him, why you always split? You split on me. That is not PTSD. If I'm not saying I know what happened in their marriage. None of us do. I believe there was IPV. I can't say, one way or the other. I mean, it seems based on the evidence they presented in court that Amber seems to be the one to instigate or perpetrate it more. But this audio is not someone who's traumatized by being beat by their partner and trying to avoid a stimuli. This sounds like someone who is trying to avoid abandonment. And it's like, this is clear as day to me. Another thing I noticed, I was looking at the backgrounds of Dr. Curry and Dr. Hughes. I got Dr. Hughes first. This is her page. Has a very nice picture. She specializes in the assessment and treatment of interpersonal violence, traumatic stress, PTSD, and anxiety disorders, and women's mental health. So, although in her testimony she says that she takes things with a healthy dose of skepticism, and she doesn't automatically believe what she's told, I know just from being in the field, working, I had an internship in the emergency department where they had a domestic violence unit that would, assess people that came to the ED for injuries and such. And the field of IPV and domestic violence is heavily, heavily biased. It assumes she, her pronouns for the survivor of abuse and that the perpetrator is he, him. I have seen with my own eyes, being an internship of other professionals in a way coaching females on, I characterize it as coaching, but they were asking very leading questions, which would cue a woman in on, oh, I need to say this or that to get my charges dropped if she was charged with domestic violence, or what do I have to say to be able to get a restraining order. And I found that very disturbing because, yeah, you can't you can't be biased. You're not there. You're not in the relationship, like Dr. Curry said. So we're not investigators. And I think that was way out of bounds what I saw for another professional to kind of lead a patient in that way in what to say. But she does have, I'm sure she's a wonderful psychologist, Dr. Hughes. She has a lot of experience. And her specialties, like I said, they're mostly just PTSD, the domestic violence, anxiety disorders. And so if we look at Dr. Curry website, she has nice pictures. Well, her specialties, she goes through her credentials a lot of specialties here. So yeah, military psychology, child adolescent therapy, couples therapy, forensic psychology. She does specialize a lot in couples and IPV. More convincing about Dr. Curry's testimony, besides my own professional experience and how I could form opinions, she seemed to use differential diagnosis. And so many of you are like, what the heck is differential diagnosis? That is when you're assessing a client and you want to get to the correct or the most accurate diagnosis to treat, you kind of assume like, okay, these are the symptoms. What could they all be? Because there's a lot of overlap with these disorders. So if you think about, again, the post-traumatic stress, some of the symptoms they said were emptiness. It was, anger, lack of interest in activities you once enjoyed, difficulty maintaining close relationships. Well, that's the same thing with BPD. You feel empty. You don't have stable relationships. You may not have particular things you enjoy doing because of that, unstable sense of self and not being able to identify with what your own interests are. So you see there's a lot of overlap, and you need to kind of look at what it all could be and then start to rule out. So I want to show one more testimony clip from Dr. Curry where she seems to do that. She tested Amber Heard as well for PTSD, and she found that Amber Heard exaggerated or feigned a lot of those symptoms. And so we'll look at that now.
I also gave her the CAPS-5. I don't know if you'll remember, but that is the clinician-administered PTSD scale consistent with the DSM-5. And on that, there were signs of gross exaggeration. I also looked at the test results that were provided by Dr. Hughes, and on an objective test of trauma, there is a scale specific to intentional exaggeration on that test, and Ms. Heard was in the 98th percentile, meaning that she had engaged in extreme levels of exaggeration.
Thank you. You were asked about intimacy problems, relationship difficulties associated with IPV, and you then said that there were some key differences.
Yes.
What are those?
So what you see when we're talking about the personality disorders is there is a very consistent pattern of the aggression, the violence, the irritability. First of all, it's escalated. But second of all, it occurs when there is either, for the borderline component, a threat of abandonment, a perceived slight, feeling like the person is about to leave you, about to walk away to get some space from an argument. It also occurs to a more mild extent, but when there's a loss of attention and a need to manipulate to try to get that attention back. But it's not, when somebody has PTSD, that irritability is sort of at a low, constant level, or it's completely random. For instance, you might have a Vietnam vet who went straight to bars for a period to get into fights with the hope that he would kill somebody and just self-destruct. So it's a very different type of presentation. IPV, it might be more irritability, but that's actually less of a symptom for female IPV victims. Usually what you'll see is somatic symptoms, the depression, a lot of fearfulness and anxiety, but typically more complaints about somatic symptoms.
Okay. You testified that some of the professionals involved in this case had to take their patient at her word. What did you mean by that?
So when you're providing therapy, you're in a very different role than an examiner. When you're the forensic examiner, you're just really looking at data to make a decision. When you're a therapist, you're an advocate for your client's well-being. And in fact, it's considered extremely unethical for a treating provider to ever provide opinion testimony like I'm providing, because it's so well known in our field that you're going to have an automatic bias for your client. It's almost a sense of protection, advocacy, wanting their best, which is why we also know that it's very inappropriate to convey any sort of opinion about whether a crime occurred, whether abuse occurred. We can certainly believe our clients. We can support them in their therapy and take them at their word. But when giving opinions and consultations, we have to be very, very cautious and really only provide the facts. We would state things in terms of, my client did report this. I saw this. Here was our treatment plan. Here was the diagnosis. We're taught, we're trained to stay away from making any sort of opinions, understanding that most of the time, and most of Ms. Heard's providers were just treating Ms. Heard. They had never so much as done an initial interview with Mr. Depp and gotten his whole life story or his symptoms or his side of any of it. And they're going to be advocating, and the treatment relationship is about helping your client achieve well-being, not making formal psychological or psychiatric opinions.
So you're asked a question about a series of doctors. Dr. Cohen, treating physician?
Yes, he was a psychologist.
Yeah. Dr. Banks, treating physician?
Dr. Banks, yes, treating psychiatrist.
Dr. Anderson?
Yes, treating psychologist.
Every one of them had to take Amber Heard at his word, right?
Yes.
Yeah. So I liked how Dr. Curry summarized how she was able to remain objective, what the role of a forensic psychologist is versus a treating physician. And Dr. Hughes has that same role as well. And I have no doubt that she, attempted to be objective. She came across to me as a little biased, but not because she was biased for Amber Heard, but more so biased for women. And I think her testimony would have reflected a little bit more objectivity if she had said, I believe Amber Heard suffers from post-traumatic stress disorder, and that the traumatic event is related to the reported violence that she, claims she experienced. That puts some distance because you're not making that opinion, or like Dr. Curry says, you're not saying, oh, this crime occurred or Johnny Depp did do this. So to me, Dr. Curry's was more of an objective professional. But just from my own experience with treating individuals with both PTSD, borderline, and other mental health conditions, I definitely, and just seeing the evidence in the case, I definitely side with Dr. Curry's assessment. So I hope you guys found this informative, and I hope to see you on the next video. Please like, share, and subscribe.